Now, the United States has a very big, a very complicated, and a very hard to understand healthcare system that has evolved over the last 100 years. We've had a long-standing history of failure in efforts to comprehensively reform the healthcare system here in the United States. And it seems to me that there's at least three main explanations as to why we've done so poorly up until now. Reason number one, healthcare is a $2.5 trillion industry in the United States. 16% of our gross domestic product. Every one of those dollars is somebody's income. Any effort to reform the system has a major impact on people's income. And so the interest group fighting, the interest group battles over healthcare reform are fierce. So interest group politics is number one. Number two, we have a political culture in the United States which goes way back to the 18th century and to the formation of the country. We have a political culture in the United States which is largely anti-government, which believes to a large extent that big government solutions are problematic rather than helpful. We have a political culture which does not strongly believe in what the Europeans might call social solidarity, the notion that the young should take care of the old, the healthy should take care of the sick. We believe in personal responsibility. We believe in markets. We believe in capitalism. We believe in competition. And given that context, whenever there's been talk of major government efforts to try to deal with the problems of the healthcare system, there's fierce resistance. That's issue number two. Issue number three is that we've created political institutions in this country that reflect the political culture that we have, that make it easy for the interest groups to block reform. Well, President Obama, like Teddy Roosevelt, like Franklin Roosevelt, like Harry Truman, like Richard Nixon, like Bill Clinton, President Obama knows about these obstacles. He knows about the prior failures, and he said to himself, how can I overcome the interest group obstacles? How can I overcome the cultural obstacles? How can I overcome the institutional obstacles? And he developed a political strategy designed to do each of those things. He said, and his colleagues said, we have to, number one, make health care our number one domestic priority. How do we do that during the time of an economic crisis? We tie health care reform to economic reform. There was a major effort in the legislation to deal with the problem of the uninsured in the United States. So there will be about 16 to 18 million Americans who in the next several years will become eligible for the Medicaid program, who are not eligible right now, so a major Medicaid expansion. Number two, Congress created these new, what we call purchasing pools or insurance exchanges, through which the uninsured and small businesses will presumably be able to buy lower-cost private health insurance with the help of significant subsidies for many low-wage workers from the federal government. So there'll be another 16 to 18 million folks who will get private health insurance, many of whom will be helped by the federal government via subsidies. Number three, there is an individual mandate that was enacted by Congress, which basically says to all Americans you have to have health insurance, which is enforced through the tax code. There's not a terribly significant financial penalty, so some Americans, particularly young, healthy Americans, may choose to actually pay the penalty rather than buy the health insurance, which could be problematic, but there is that individual mandate. Fourth, there's a requirement that those employers with more than 50 employees who do not provide health insurance to their employees have to pay a financial penalty. Fifth, there's a whole series of new regulations limiting the ability of the private insurance industry to discriminate against those with pre-existing conditions and other high-risk situations. There's an effort to pay for these insurance expansions through a series of new taxes on the wealthy, new taxes which will begin really in 2018, but new taxes on high-cost health insurance plans. And then there's a whole series of reimbursement cuts to the Medicare program, which will help pay for the cost of those insurance expansions. So let me point to just one item that takes effect almost immediately within the next couple of months, and that is that 18 to 25-year-olds will be able to stay on their parents' health insurance coverage even if they're no longer in school. And that goes into effect immediately. This is a huge bill, much of which will not even take effect until the year 2014. You know all these Medicaid expansions I've been talking about, the individual mandate, the penalties on employers, the new insurance exchanges, the subsidies to low-wage workers. None of those items take effect for the next 4 years, till 2014. And in between now and, which is a problem, but in between now and 2014, we have to figure out how to make all those things work. We have to figure out what these insurance exchanges really are. And we have to create them. We have to figure out how to regulate the private insurance industry to reach the results that we've said we want to reach in this legislation. We have to figure out what the Medicaid expansion is really going to look like. How are the states going to really add 16 to 18 million folks to the Medicaid program? What kind of impact is that going to have on the states, who are very nervous? Many state officials are very nervous because they will pay at least some of the cost for these expansions of the Medicaid program.